My name is Master Sergeant Mandy Hazelton, and I would like to share with you a few of the modifications that the 78th Medical Group has put into effect to combat the COVID-19 virus. On 12 March 2020, we recognized the need to collect COVID-19 samples while minimizing the exposure to the staff. Initially, each test consisted of a nasal flush, which was performed in a dedicated isolation room. While necessary at the time, this procedure posed a higher risk of exposure to our medical staff. Once we were cleared to collect samples using nasal swabs, we created an outdoor drive-up option for patients that met the pre-screening criteria provided by the Centers for Disease Control and Prevention, also known as the CDC. Once a patient called the Central Appointment Center expressing signs or symptoms of the virus to include cough, fever, difficulty breathing, and recent travel to any of the high-risk areas or contact with a person who is positive, they became a person under investigation, or PUI. A primary care team will then coordinate drive-up sample collection. Results can take multiple days, and the patient is placed on quarters or quarantine until test results are in. On 16 March, our group practice manager, Captain Abigail Mixon, formulated a plan with various clinical teams and the central appointment clerks to convert the clinical routine care appointment schedules from in-house visits to virtual care. The primary care teams, mental health, dental, and physical therapy began to contact patients to offer medical care over the phone or through secure messaging. Rather than scheduling in-house appointments for acute care, the central appointment clerks send messages to the appropriate primary care managers marked for appointment screening. The primary care manager then determines if the patient is in need of a face-to-face or virtual appointment. On 16 March, the medical group also instilled a single point of entry. Captain Mason Niemeyer designed a screening process at the main entry of the clinic with all other entrances secured from incoming traffic. The screening consists of medics greeting patients upon entrance and asking them a few simple COVID-19 related questions to determine if they should be donning a mask due to risk of exposure or potential spread. Depending on the patient's response, they can be placed in either a high-risk or low-risk waiting area and then escorted to their appointment by a primary care team member. The entry control point screening team have masks, hand sanitizer, and gloves readily available for first-line protection from the virus during the initial screening. Major Lee Craft Shakes, our diagnostics and therapeutic flight commander, modified the pharmacy operations to reduce the number of patients in the pharmacy waiting area. Each patient is screened at the single point entry to determine if they are in the medical group to pick up or activate prescriptions. Just behind the front screening area, a pharmacy technician is in place at a separate desk to activate scripts. Once activated, they will provide a realistic time for the patient to return for pickup. When they return, they simply select the ticket request, notifying the pharmacy staff that they have returned for pickup. This has significantly reduced in-pharmacy wait times from up to 60 minutes down to 8 minutes or less. In addition, the seats in the pharmacy area have been separated to allow 6 feet of social distancing and are wiped down periodically. Additionally, each pharmacy pickup window is regularly disinfected. These are just a few of the modifications that the 78th Medical Group has made with a focus and mission of reducing the risk of spread and contraction of the COVID-19 coronavirus for our patients and medical personnel. As your Air Force medical home, we look forward to continuously serving you and your medical needs.